Hello, everybody, and welcome to what would be episode 59 of CCA's Medical Minute podcast. I'm here to do something a little bit different today. The first thing I'm going to do different today is I'm actually going to try to stick to a script, which I can tell you my coworkers and my wife know that I'm loath to try to do that kind of thing. But first and foremost, I wanted to, I hope everybody had a great Thanksgiving weekend. I certainly did. And I'm sitting here, I'm bedecked in my finest holiday regalia, including the ridiculous glasses that Joe Hunt would normally make me wear throughout the Christmas season. So anyway, but I'm here by myself because I wanted to tell you about some changes we're going to make to the Medical Minute podcast. Since the day we started this podcast, we've brought you weekly episodes that we release pretty much at the exact same time and on the exact same day of the week, which is Wednesday at noon Eastern. Throughout those 58 episodes, I think we've brought you timely and relevant content. I hope you found it to be relevant, and I hope you found it to be entertaining because we've enjoyed doing it. However, our practice is growing, which is the good news. We've grown quite a bit since we started, but it's making a little bit more of a challenge to stick to our regular schedule. As an example, we're going to see almost 400 patients this year. That's almost double when we started. And we haven't charged anybody. We still haven't charged anybody. We haven't charged the patients. We haven't charged their insurance company. We haven't charged Medicare or Medicaid because we feel like that gets in the way of patient care. So we want to stick to those principles. And it's going to get even more challenging as we embark on a brand new adventure in the beginning part of 2023 when we open our second office in Naples, Florida, where Cincinnati residents spend a significant part of their time. So that's going to take up as a good amount of our time as well. So, and even on that note, my own cancer-related challenges are going to compromise my ability to devote the time that I've devoted to it in the past. So I'm going to ask our Director of Strategic Community Engagement, Sherry Hughes, to take an even greater role in developing the content for the podcast. Sherry's well equipped to do that after spending almost her entire career in television. Going forward, I can't promise you that we'll be doing an episode every week. I can't even promise you that we'll be doing it on a regular schedule. However, I can promise you that we'll do a podcast whenever conditions warrant, whenever there are developments in the oncology space that we feel like our viewers would find interesting and helpful or would like to know about. Now, the flip side is we're going to be supplementing this with more robust social media content that Chris McNeil, our executive producer, and Jake DeHart, our marketing manager, will be delivering to you throughout the year as there are breaking developments in the cancer space when research conditions warrant. So that'll give us a chance to be a little bit more timely and a little bit less structured, which I'm excited about. In closing, I'd like to thank all of our viewers, particularly the ones that have been with us since our first podcast in November 2022. I can tell you we've had a lot of fun doing this. I've appreciated the chance to build my own cancer knowledge as a result of sitting side by side with my brilliant CCA colleagues and the many guests that we brought onto the show. I would like to ask you to please maintain your subscription because we're still going to be coming to you from time to time, maybe just not quite as often. And so stay tuned in 2023 as we continue to bring you important cancer-related content with respect to early detection, genetic testing, research developments, and better treatment options. I look forward to seeing you back here again soon. And in the meantime, I wish everybody a fantastic holiday season. Thanks, everybody, and we'll see you again soon. Thank you.